Welcome to Dementia Forum X YouTube channel. Today I'm talking to Petra Tegman, a nurse specialized in dementia care and palliative care. Hi.
Hi.
How are you?
Good, thank you.
I'm happy to hear it. So my first question for you is actually about you and who you are. So please tell us a little bit about yourself.
Petra Tegman, as you mentioned. I'm the CEO of SCI that runs Dementia Forum X. I'm also a specialist trained nurse, as you mentioned, in palliative care and in dementia care. And I've been working in the elderly care field and in the palliative care field for more than 25 years. So that's where I have my main interest.
Right. And you are also the CEO of Swedish Care International, who is the main organizers when it comes to Dementia Forum X. What do you want to accomplish with dementia, with regards for Dementia Forum X?
Many things, but mainly to spread awareness and knowledge related to dementia related questions and issues, and not only about research but also about the society perspective, business perspective, the finance perspective, and so on, in a broader field than only the research that we can see continually growing all over the world. But in regards to finance sectors, what is important for people working in finance to know related to Alzheimer's and dementia diseases, for example.
In your experience as a nurse and obviously also as an expert in these fields, what would you say is the difference between elderly care and dementia care?
Big difference. Elderly care in general is the kind of care that we provide for our elderly community. But when it comes to the patients living with dementia, there is another perspective to it. Dementia is not a part of normal aging. It is a disease that could affect any one of us. And the highest risk of getting dementia comes with high age. So the longer we live, the higher the risk is to get a dementia disease. And dementia care really needs to be, the staff needs to be well trained to be able to provide good care for somebody with dementia. Because if you have dementia, and especially if you have in mid stages or later stages, you are unable to express your own feelings and your own what kind of care you would like and what kind of help you need. We have to be small detectives to find out in what way we can help you to make you feel comforted or relieve all your symptoms and everything. So it's a big difference, because in the normal elderly care, if I would use that expression, is they can say for themselves what kind of need they have and what they want us to help us with. But when you have a dementia disease, you lose that ability. So we need to try to figure out how we can help you in best possible way.
And what would you say is the biggest challenges when it comes to dementia care compared to elderly care? Like which areas would you say is most difficult?
To know that we are doing the right thing. That's why we always have to try and always have to evaluate also if this is helping you or not. We have to be very aware of what kind of symptoms you have and what kind of symptoms you are showing. Also because you might be unable to tell us that you might have a toothache, you might be in severe pain, but you don't really know how to express that, and you might show with anxiety, worries, perhaps aggression, because you are in severe pain. So the difficult part for me is as a caregiver is to find out how I can help you, if it really is pain you're having, or if you're worried and excited, or what really is the symptoms that is causing you a discomfort at the moment.
Right. And it seems that you're talking about communication mostly, because it's difficult for people suffering from dementia or living with dementia to communicate their pains and problems. So in what way can you kind of understand what they're trying to express, or what they would have expressed if they could have expressed it?
Yeah, person-centered care is the #1 approach. We have to always think for your perspective. In what way did you used to be? What did you used to like doing? Have you had any kind of pains previously before you had your dementia disease, like back pains or something that we need to be aware of. And for this, we always need the family. The family members are the history book of our patient. They have a lot of information and also a lot of knowledge in telling us what kind of food the patient like. You might be upset because I'm serving you something that you don't even like or you don't even eat. So we need a lot of information from family members to try to figure out in what way we can help you.
Right, and that brings me to my next question actually, because if you are a family member, if someone in your family have received a dementia diagnosis or show signs of having dementia, what are the steps they can take to get their loved one the best care they can get?
Good question. I think that is very much related to which country you live in. So what kind of support and help there might be for you to have. But in the first stages, a lot of the family members provide the care themselves in the beginning and try to help their husband or wife or mother or father as much as possible. But I would say most of the cases come to a certain point where you need to take help from outside. And first that could be with home care, somebody coming home and giving you as a family caregiver some time to do something else, perhaps go out for lunch with friends or go for a golf round or for a walk and just take some time alone for yourself. That is very important. We cannot let the caregivers forget themselves. They need to get some time off, because taking care of somebody who has dementia is a full-time job and it is not a single person's job. You always need help. So first step could be home care, and then eventually might be some nursing homes have the ability for the patient to go there and stay for a week and then come home for a week, and you can do this back and forth if that works out for the patient, if that is a good way for the patient and it doesn't get too confusing. That could be a start, and then in the end it might be that you need to move into a nursing home in the later stages. And for family members, that is always difficult to find out when is that time. When do I need more help and assistance, and when does my husband or wife need to move to nursing homes?
Right. And as you said, in some countries it's not as easy as it is in Sweden, for example. Could you talk a little bit more about that? What are the challenges that other countries are facing when it comes to dementia care? Where is the problem lying there? Why is it more difficult?
Well, in Sweden we have a really good welfare system, so we can get the help that we need and we don't have to pay a fortune for it. It is in our welfare system. But in some countries you have to pay out of pocket for it, and if you don't have all that money, and if you might have to stay home to look after your husband or wife and not be working yourself, you're losing an income and it might be difficult to get that kind of money for it. And also in some countries dementia diseases are not well known. It's nothing you really talk about, and you don't get the diagnosis easy as you do in Sweden, which makes it very difficult to get the right kind of help. So first of all, you need the right assessments, you need a diagnosis, and you need the right kind of professional help to be able to get the right care. But if the disease is not common in that country where you're living, it might be very difficult to get the right kind of help and support.
Would you also say that there might be a stigma towards dementia?
Oh, for sure.
In some part of the world?
Yeah. I think there is in all parts of the world, definitely. But in Sweden, for example, if you get the disease, you can get help because it is provided here. But in some countries, if you get a dementia disease, you are looked upon as something sent from the devil. Or there can be really bad discussions, or psychiatric disease, or something that you're going insane or going mental. Really, really sad and really bad thoughts, which are so incorrect.
Right. And I suppose also that a common misconception is that dementia is kind of a natural consequence when you grow older.
Yeah.
So it's not taken as something abnormal, it's seen as almost expected, which is obviously not true.
Yeah, sometimes also in some countries you are looked upon as something you can only blame yourself. If you wouldn't have done this, you wouldn't get the disease. If you wouldn't have done that, you wouldn't get it. But that's not the case. It can affect anyone.
Right.
There are only a few dementia diagnoses that are something you can control or get yourself. But like, for example, a high alcohol consumption that could affect your brain eventually. So yes, in that case, maybe, but there is still like an Alzheimer's disease, anyone can get it. And Alzheimer's is the number one dementia and cognitive decline disease we have. So.
Exactly. And obviously, the hope with this YouTube channel and with Dementia Forum X is to kind of inform people about this and reduce those kind of prejudices that exist.
Yeah, it's not a part of the normal aging, and it could affect anyone.
Right. Aside from dementia, you're also an expert when it comes to palliative care. Could you explain what that concept means and yes, what it is?
Well, palliative care is sometimes misunderstood because you think of it as care in the end of life care. But it is really not. Palliative care is the kind of care that we provide for a patient that has a disease that is uncurable. So if you get a disease that we cannot cure, we will provide you with palliative care. And Alzheimer's disease is, unfortunately, we don't have a cure for it, which means that we can start looking upon palliative care perspective, the philosophy, early on. That doesn't mean we're not going to do anything for you. We're going to help you in all kind of way, because the goal with palliative care is always to make sure you have the best quality of life. So how can we help you with this despite the disease that you now have? So in the early stages of an Alzheimer, it might not mean so much to you. But in the mid and the later stages, we start talking more about in what way can we make sure that you have best kind of quality of life, and start thinking about when is treatment for other diseases that might come up at the same time. For example, you get a cancer disease at the same time as you have a severe dementia. Okay, should we do something about that cancer treatment? Or we need to have discussions about how to make sure you have the best kind of quality of life all the way through the diagnosis. And this is very individual. There is no right or wrong or so on. This is person-centered care at the most. We really need to think about what is best for you and how can we help you, and what do you think is important, and your family also, of course, what is important to them.
Right. And to be clear, it's palliative care concerns when you have an uncurable and terminal illness.
Yes.
So there's no hope for survival.
Yeah.
And that's a kind of end of life care.
Yeah. It could mean end of life, but it could be for many years also. It is the same with like for Alzheimer's. You can have Alzheimer's for 15 years. That doesn't mean you're getting close to end of life. But how can we make sure you have the best time of your life, really good time and highest potential quality of life during these 15 years? How can we support you with that, and what is important to you? And it's the same with some cancer diseases also. They might be not curable, but you can live for many years with the disease. And how can we make sure these are good years? We need to make sure the most important thing also with palliative care is to ease all your symptoms. And how can we do that? In one way, even though there are physical, psychological, existential, or social. We talk about total pain sometimes. So all of these 4 dimensions are really important for us as caregivers to make sure we can help you with.
Yes, and so the palliative care is kind of a shift of perspective, right? Because you go from trying to heal to trying to comfort, basically.
Yeah, more or less, yeah.
Is there any obstacles when it comes to palliative care? Is this accepted concept worldwide, or do you see a difference between different?
Same as with cognitive diseases, no, it is not. It is not. Some cultures and some countries are better to talk about death than others.
Right.
Because also what is important, working in palliative care, you always have to reflect on your own thoughts and concerns related to your own death. You have to think about these things. To me, the only thing we know for sure about our lives is that we will die. We will all die one day. We don't know how and we don't know when, but we will die. And if I get a disease that would be terminal, that is uncurable, I would for sure want to make sure and get the right kind of help to make the last part of my life as good as it possibly can be.
Right. And the standard kind of ethical viewpoint is that you ought to save every life, and you can't really not. I mean, it's common that you don't that doctors and hospitals and people working within healthcare, they don't want to accept death as an outcome.
No. That is very common in all countries, I would say. As a nurse or as a doctor, we are trained to cure and treat people. We are trained to make you feel better and live longer. But when it happens that we cannot do so any longer, how can we help you get the best kind of quality of life despite the disease? Because we cannot cure it now, but how can we help you with it? And yeah, that is very challenging. It is very difficult in many countries. You need to practice, you need a lot of knowledge to do it, but it is very important, very important.
Right. And clearly it is, I mean, it seems obvious perhaps to some people that at the end of life, or when you can't really, when there is no hope for survival, that a shift in the perspective of how you take care of the person is necessary. A less obvious concept is, that is related to this, is euthanasia, which is when you basically help someone to end their life. How does that concept differ from palliative care, and is there room for that concept within that palliative care? What is your thoughts on that?
Still same with some kind of issues related to palliative. There's no right or wrong. This is totally person-centered. In Sweden, it is not an option. You cannot get that kind of help in Sweden, and it's only in a couple of countries in Sweden, in Europe, that you can do it. But of course, there is always a discussion related to it. And to me, I think it is an option that I can only decide for myself what I would think would be best. And I have thankfully not been into that position yet, that I have to make that decision. But I have full respect for people who do it, who decide they have an illness, for example, ALS or something that they know might be painful at the end of life, or they don't want their family members to be part of it. So they want to end it before the disease ended for them. So, but to me that is, as a nurse, I'm not in the position to judge anyone who does it, who wants to do it or not, but it is not the same thing as palliative care. If you choose not to do it, not to get assistance and take your life and before the disease does, we will do everything we can in palliative care related to help you ease all your kind of symptoms. And for example, in Sweden we have medicine that we can put you to almost like you're in a sleeping stage all the time, and the last hours or days of your life, so you get revealed of like all of the symptoms. So I think there is a discussion that needs to be ongoing, and I think it is difficult to be someone else telling you what you should do, because I am not you.
Right, and it's especially difficult in the case of dementia when you can no longer give consent, perhaps.
Absolutely, definitely. Definitely.
So it is a conundrum, but it is being debated.
Yes, it is.
So do you wish to add anything else about your own work with these kind of things like palliative care and dementia care?
Well, I always talk a lot about when it comes to both, well, especially when it related to dementia care, but in all kind of care, and even if we're talking about euthanasia or whatever, but it's always the question we always have to ask ourselves is, for whose sake are we doing everything we're doing? For whose sake are we giving this medicine, this treatment, this kind of provided help or assistance? For whose sake are we doing it? As long as we can give the answer that we're doing it for the patient's best, yes, continue doing it then. But we cannot do it for my own best as a nurse or as a doctor or whatever. We have to always figure out for whose sake are we doing it. Right. And especially when it comes to some kind of treatments, especially in the later stages of dementia, I think this question is very relevant. We need to really think about and reflect upon, will this treatment lead to anything good for the patient? Yes, of course, then we will do it. But if not, we need to think about it again, rethink it again.
Yeah, and that is the core values, I suppose, when it comes to person-centered care.
Yeah.
All right, thank you for participating in this interview, and I hope that we will talk again about other things concerning healthcare. And have a nice evening.
Thanks, you too.
Thank you.